12 early signs of heart failure you should not ignore. Sometimes, the earliest warnings your heart gives aren't loud or dramatic at all. They sneak in quietly, showing up as little changes you might blame on age, stress, or just being tired. But these small signals can be the first steps towards something far more serious. And this is where danger begins. Many people never notice the shift until their body is already struggling, because the early signs of heart failure don't always feel like heart problems at all. You might brush off unusual fatigue, swelling, or shortness of breath as a busy week, sore muscles, or a bad night's sleep. And that's exactly how heart failure hides, by disguising itself as everyday discomfort. The truth is that millions miss these clues, not because they're careless, but because the body speaks in whispers long before it cries for help. What makes this so important is that early detection can completely change the path ahead. When you understand what your body is trying to tell you, you gain power, not fear. You stop guessing and start noticing. You step into the role of someone who protects their future instead of reacting too late. And as we go through these 12 early signs, there's one in particular that almost everyone overlooks, even though it appears in the very beginning. Missing it can cost precious time, but recognizing it can give you a real chance to act before your heart becomes overwhelmed. You deserve to understand these signals clearly, without fear, but with a strong sense of awareness. Most people never get this opportunity, yet you do, and what you learn right now could shape your health for years to come. So as you listen, stay open to the possibility that even the smallest change carries meaning. Your heart is always speaking, and when you learn to hear it, you don't just avoid decline. You choose a stronger, safer, more confident future starting today. This journey begins. Sign number 12 is unusual fatigue that doesn't match your activity. This is the kind of tiredness that feels out of place, showing up even on days when you haven't done much at all. It can feel as if your body is running on a low battery that never quite reaches a full charge, no matter how much you rest. Many people notice it but explain it away, thinking it's stress, age, or just a busy week. But the truth is that your heart might be struggling to deliver enough oxygen to your cells. When the heart can't pump efficiently, the body reroutes energy to the most essential functions, leaving you feeling drained from the smallest tasks. Walking across a room, climbing a few steps, or even getting out of bed can feel heavier than they should. Normal tiredness fades after sleep, food, or a break, but cardiac fatigue lingers. It feels deeper, heavier, and strangely disconnected from what you actually did that day. And that difference matters because this kind of exhaustion is often one of the earliest clues that the heart is under strain. Understanding this can shift you from worry to awareness. Instead of ignoring the signal, you begin to see it as information your body is offering to protect you. You are not powerless in this. The moment you notice unusual fatigue, you gain the chance to ask questions, seek guidance, and act early. Listening to this sign doesn't create fear, it creates control. It helps. Sign number 11 is swelling in the ankles, feet, or legs, a condition known as edema. This happens when the heart struggles to pump blood effectively, causing fluid to build up in the tissues. You might first notice it in the evening, when your feet feel heavier, shoes tighter, or socks leave deeper marks than usual. Sometimes it appears after sitting for a long time, almost as if gravity is slowly pulling the fluid down, reminding you that your circulation is under strain. It may feel minor at first, easy to dismiss, but this subtle change is your body signaling that something isn't flowing as it should. Imagine the sensation as your body quietly holding onto water, a visual reminder of pressure building from within. Over time, swelling can extend higher up the legs, and the skin may start to appear shiny or puffy, indicating the heart's growing difficulty in moving blood efficiently. Recognizing this early is crucial because it's a tangible clue that can't be ignored. If swelling is paired with symptom number 7, it becomes a major red flag. one that deserves immediate attention and careful monitoring. Understanding these changes gives you power instead of fear. Noticing swelling isn't about panic. It's about awareness, insight, and timing. Acting on it early allows you to make choices that support your heart, improve circulation, and protect your health. The body communicates constantly, and swelling is one of the clearest ways it asks for help, guiding you toward prevention before the condition worsens. Awareness here is your first step toward control. Sign number 10 is shortness of breath, especially when lying down, a symptom that can feel alarming and unsettling. This occurs because weak heart muscles struggle to pump blood efficiently, causing fluid to slowly back up into the lungs. At night, when you lie flat, gravity no longer helps keep fluid in the lower body, and the lungs may fill more easily, making each breath feel heavier. Medical experts call this orthopnea, and some people even experience paroxysmal nocturnal dyspnea, a sudden bout of breathlessness that can wake you in the middle of the night. Understanding these terms isn't just medical jargon. It's a way to recognize that your body is sending signals before a bigger problem develops. You might notice that while climbing stairs or walking can leave you slightly winded, it's at bedtime that the sensation becomes sharper, almost panic-inducing. Your chest feels tight, your breathing shallow, and the simple act of lying down triggers anxiety because your body resists the position. This nighttime struggle is not just discomfort. It's an early warning that your heart is under strain and needs attention. Recognizing shortness of breath in these moments gives you power. It is your opportunity to act before the condition worsens, to discuss these patterns with a healthcare professional, and to make choices that protect your heart. Understanding why it happens, why it gets worse at night, shifts fear into awareness. Awareness becomes control, and control becomes a pathway to prevention and stronger heart health. Sign number 9 is a rapid or irregular heartbeat, a sensation that can catch you off guard and make you suddenly aware of every thump inside your chest. This happens because the heart is working harder to compensate for reduced pumping efficiency, trying to keep blood flowing to the body. You might notice palpitations, a fluttering feeling, skipped beats, or an early form of arrhythmia that seems to come out of nowhere. Many people feel this but dismiss it as stress, caffeine, or fatigue, not realizing it could be an early signal of a heart under pressure. The tension this creates is hard to ignore. Your body suddenly feels louder, more insistent, as if it is trying to grab your attention. Feeling each heartbeat in such a vivid way can be unsettling. Yet, it is precisely this awareness that provides an opportunity to act. Being in tune with your body, rather than dismissing the signs, can give you a crucial advantage in identifying heart issues before they progress. You might think this is a minor symptom, but it shouldn't be overlooked. Many people miss these early warnings, and yet recognizing them empowers you to seek guidance, monitor patterns, and take preventative steps. Paying attention transforms fear into control. Each irregular beat becomes information, a message from your body encouraging awareness, early action, and a stronger, safer path forward for your heart. Sign number 8 is persistent coughing or wheezing, a symptom that can quietly signal your heart is under stress. Unlike a typical cold or seasonal allergy, this cough tends to linger, often producing white or even pink-tinged mucus. It happens because when the heart struggles to pump efficiently, fluid can back up into the lungs, creating congestion that triggers repeated coughing or wheezing. Many people mistake this for asthma, flu, or simply a lingering respiratory irritation. But in the context of early heart failure, it is a warning your body cannot afford to ignore. This symptom often feels subtle at first, appearing during the day or worsening at night, leaving you curious and concerned about its cause. You may notice that no amount of rest or over-the-counter remedies truly eases the cough, hinting that something deeper, is at work. By recognizing this, you gain clarity and insight into what your body is communicating. Persistent coughing becomes a message rather than a nuisance, urging you to pay attention before more serious complications develop. The urgency grows when this symptom appears alongside others, particularly shortness of breath while lying down, which can indicate fluid is significantly affecting the lungs. Understanding this connection transforms worry into empowerment. By noticing these early signs, you step into a proactive role, able to seek guidance, take protective measures, and address your heart's health before it reaches a critical point. Your body is speaking, and listening could change everything. Sign number 7 is sudden weight gain, often 2 to 5 pounds within just a few days. And it's a warning your body sends long before more obvious symptoms appear. Unlike the gradual changes we usually associate with diet or lifestyle, this kind of weight gain is not fat. It's fluid accumulating because the heart isn't pumping efficiently. When cardiac output drops, the kidneys retain more salt and water, leading to swelling and rapid weight changes. Understanding this shifts the perspective entirely. It's not about what you ate or how you exercised, it's your heart signaling distress. This early sign can be subtle but powerful. You might notice your rings feel tighter, your shoes pinch, or your clothing fits differently overnight. At first, it can be easy to dismiss these changes, thinking they are minor or temporary. But medical experts recognize that rapid fluid retention is one of the clearest early indicators that the heart is struggling, and paying attention here can make a significant difference in outcomes. Recognizing sudden weight gain allows you to reclaim control over your health. By responding quickly, tracking changes, and seeking guidance, you turn a warning into actionable insight. Your identity shifts from passive observer to active protector of your heart. Each pound gained becomes information, a signal you can act upon, helping prevent further strain and supporting a stronger, more resilient heart for the days ahead. Sign number 6 is reduced exercise tolerance, a change that often arrives slowly but unmistakably. Tasks that once felt effortless, climbing a flight of stairs, walking to the store, carrying groceries, begin to feel heavier, more taxing, and surprisingly exhausting. You may find yourself pausing more often, catching your breath sooner, or noticing a subtle tightness in your chest that wasn't there before. This happens because the heart's pumping ability is compromised, leaving muscles and organs with less oxygen than they need to function comfortably. The frustration and confusion this causes are real. You're still the same person, still active, but suddenly your body seems to resist the movements it used to handle easily. It's normal to feel concerned, even fearful, when your strength and endurance no longer match your expectations. Yet within this discomfort lies an opportunity. Recognizing reduced exercise tolerance as a meaningful signal from your body allows you to act before the strain becomes serious. Understanding this symptom provides clarity. It isn't about laziness, aging, or lack of effort. It's a sign that your heart needs attention. By acknowledging it early, you step into a proactive role, seeking guidance, adjusting activity safely, and making choices that protect your heart. Reduced exercise tolerance becomes not a limitation, but a call to awareness, empowerment, and the chance to maintain strength and vitality for the future. Sign number 5 is abdominal swelling or digestive discomfort, a symptom that often goes unnoticed or is mistaken for ordinary digestive issues. When the heart struggles to pump efficiently, fluid can back up into the abdomen, liver, and other digestive organs, leading to bloating, a feeling of fullness, or even nausea. You may find yourself losing appetite or feeling full after just a few bites of food, and ordinary meals begin to feel heavier than usual. For many, these changes are easy to dismiss, but in the context of early heart failure, they are meaningful signals that the body is under strain. This type of discomfort can feel confusing because it mimics common gut issues like indigestion or bloating from diet changes. That is exactly why awareness matters. Noticing patterns, timing, and persistence can reveal that something deeper is happening. Your body is communicating through subtle shifts, urging attention before the problem progresses. By tuning into these signals, you gain insight rather than alarm, understanding that the source is cardiac rather than simply gastrointestinal. Recognizing abdominal swelling as a potential warning allows you to act early. Monitoring changes, consulting a healthcare professional, and addressing fluid retention promptly can protect your heart and overall health. What feels like a minor annoyance can actually become a turning point. Curiosity and body awareness transform concern into empowerment, giving you control over your well-being and the opportunity to respond before more serious complications develop. Sign number 4 is increased nighttime urination, a change that often catches people by surprise. You may find yourself waking more frequently than before, needing to visit the bathroom multiple times during the night. At first, it seems ordinary, something to blame on late fluids or aging, but there is more happening beneath the surface. When you lie down, fluid that has pooled in your legs and feet during the day redistributes into the bloodstream, increasing kidney filtration and prompting more frequent urination. This subtle shift can be an early signal that the heart is not pumping efficiently. What makes this symptom so easy to miss is that it rarely gets linked to the heart, even though it should. Many dismiss it as a minor inconvenience, never realizing that this pattern, repeated over weeks or months, may indicate that fluid balance and circulation are compromised. The body is offering a quiet, consistent warning, and paying attention provides clarity before the strain worsens. Recognizing increased nighttime urination as a potential sign of heart dysfunction transforms a bothersome habit into actionable insight. It encourages monitoring patterns, seeking professional guidance, and understanding the body's messages. By noticing this early, you step into a proactive role, protecting your heart before more serious symptoms appear. Awareness becomes empowerment, turning what seems trivial into a tool for prevention and long-term well-being. Sign number 3 is persistent chest pressure or discomfort, a symptom that often arrives subtly but carries weighty significance. Unlike the sudden, sharp pain many associate with a heart attack, early heart failure tends to present as a heaviness, tightness, squeezing, or a feeling of fullness in the chest. It can be mistaken for indigestion, acid reflux, or even stress, which makes it easy to dismiss or misinterpret. Yet this sensation is the heart sending an early warning, a signal that it is struggling to pump effectively and that your body's circulation may already be compromised. The tension this creates is understandable. Feeling a constant pressure in your chest can provoke anxiety, uncertainty, and even fear of decline. It is a deeply personal experience, one that demands attention because it is both subtle and serious. Medical authorities emphasize that early recognition of these patterns is critical, as acting promptly can slow progression and improve outcomes. Awareness here is not about panic. It is about understanding, clarity, and respect for the signals your body is sending. By noticing persistent chest pressure and distinguishing it from ordinary discomfort, you take a crucial step toward empowerment. Each moment of awareness allows you to seek guidance, monitor changes, and take preventive measures. This symptom becomes a tool for protection rather than a source of alarm. Recognizing it early shifts identity from passive observer to active guardian of your heart, giving you control and a meaningful chance to safeguard your health before more serious complications emerge. Sign number 2 is dizziness, lightheadedness, or fainting episodes, a symptom that can feel sudden and alarming. When the heart's pumping ability is reduced, blood flow to the brain can drop, leaving you feeling woozy, unsteady, or on the verge of passing out. You might notice this when standing quickly, bending down, or even during everyday activities that previously felt effortless. Early fainting spells are particularly significant because doctors recognize them as major predictors of underlying heart problems. These moments may seem isolated or minor at first, but they carry weighty meaning about how well your heart is supporting your body. The fear and urgency this creates are understandable. Feeling unsteady or faint can provoke anxiety, leaving you questioning your health and what might happen next. Yet, within this discomfort lies crucial information. Your body is sending a clear signal. It needs attention, and the sooner you respond, the more control you can regain over your health. Recognizing these early signs transforms uncertainty into clarity and empowers you to act rather than ignore the warning. By paying attention to dizziness or fainting episodes, you step into a proactive role. You learn to monitor your body, discuss changes with a healthcare professional, and take preventive steps that protect both your brain and your heart. Awareness here is not fear. It is action, and action can change the course of your health before more serious complications develop. Sign number 1 is difficulty breathing during routine activities, and it is the clearest red flag that your heart may be struggling. Tasks that once felt effortless, walking to the mailbox, bending down to tie your shoes, even taking a shower, suddenly leave you breathless, with your chest tightening and lungs working harder than they should. This is not ordinary fatigue or lack of fitness. It is a direct signal that your heart cannot keep up with the body's oxygen demands. Medical experts emphasize that this is the symptom most often overlooked until it escalates into a serious emergency, making early recognition crucial for protecting your health. The emotional impact of noticing breathlessness in daily life is profound. It challenges your identity, forcing you to confront that the body you rely on may no longer function as it once did. That can create fear, frustration, or even denial. Yet within this discomfort lies an opportunity, a chance to transform your relationship with your health. By acknowledging the symptom, you step into a proactive role, moving from passive observer to someone who understands the signals their body sends and acts on them. Awareness here is not panic, it is empowerment. Understanding why routine activities trigger breathlessness gives clarity. The heart struggles to deliver oxygen efficiently, and the body compensates in ways that make you feel exhausted and short of breath. By noticing this early, you gain control. You can seek professional guidance, adjust daily activities safely, and take steps to support your heart before the condition worsens. This symptom is not just a warning, it is a call to action, a chance to protect your future, and an invitation to embrace a stronger, more resilient version of yourself. Recognizing it today can change everything tomorrow. Now that you understand the 12 early signs of heart failure, the most important message is this. Early detection can prevent severe damage and dramatically improve your quality of life. Your body communicates constantly through subtle signals, and paying attention to these signs gives you an invaluable advantage. By noticing changes like fatigue, breathlessness, swelling, or irregular heartbeats, you gain the opportunity to act before more serious complications develop. Empowerment begins with awareness, routine checkups, mindful observation of your body, and adopting heart-healthy habits like balanced nutrition, gentle exercise, stress management, and proper sleep can all make a real difference. Small, consistent actions reinforce the control you have over your health and strengthen your heart over time. These choices are not just preventative, they are transformative, helping you reclaim confidence, vitality, and resilience. Remember, this is not about fear. It's about hope and action. By listening to your body, making informed decisions, and seeking guidance when needed, you can protect your heart starting today. Each step you take reinforces your ability to safeguard your future, ensuring that you remain active, strong, and in control. Awareness, action, and consistency are your tools for lasting heart health.